Hello and welcome to another episode of the TheSynapse eLearning series. With us today we have Mr. Mark Cordina. Thank you for being with us here today.
It's a pleasure.
Mr. Mark Cordina will be speaking to us about antenatal ultrasound screening due to his role as resident specialist in obstetrics and gynaecology with a special interest in obstetric and gynecological ultrasound screening. So on to my first question. What is the main purpose of antenatal screening, Doctor?
So we have to realize that pregnancy is an evolutionary process. If all goes well, most patients will have no problem at all. The main concern is that we cannot identify who the patients that will need help, that will have problems are. So that is the role of screening. Screening is looking at all the population to identify people who are going to have problems. With antenatal screening, we're treating the fetus as a patient. We're not just treating the fetus as package that is carried inside the mother, but we are giving the fetus all the investigations needed to make sure that the fetus is developing normally. The role of doing this whole process is to ensure that if there is a problem, it is detected sooner rather than later, which will help us improve the outcome at the end of the pregnancy. The way we do it is by discussion. So let's say we identify a problem, we will have a whole plan in advance so that we identify which is the best time for the baby to be born, where is the best place for the baby to be born, and who should be around when the baby is born. We discuss with the MPICU, the neonatologists, pediatric specialists, other specialists like neurosurgeons, so that we make sure that the right person is in the right place. Occasionally we also liaise with tertiary centers abroad, most commonly it's in the UK. Occasionally we also have to deliver the baby abroad. Not common, but sometimes it is done. There are certain conditions that actually can be treated antenatally. For example, certain cases of congenital diaphragmatic hernias that, if identified early, treatment can be done to improve outcome. What we also have to realize is that the patients are prepared, the parents are prepared. The parents, one has to understand that after a pregnancy, if you're given bad news soon after long labor, it's not the best time to deal with emotional trauma. If the baby has a problem, whether they know before or after delivery, they will know that there is a problem. So it is easier for them, easier for us, for everyone.
To adjust
and prepare. We also actually include the bereavement midwives and the perinatal psychiatry team when we identify problems. In an ideal scenario, screening is done with 3 big scans which is spread out throughout the pregnancy. As we know, pregnancy is divided into first, second and third trimester. In the first trimester, this scan is ideally done between 11 weeks, 5 days and 14 weeks. It can be called a dating scan or a nuchal scan, depending on what the parents wish. The aim of the scan, the basic aim, is to assess viability, make sure that there is a heartbeat, make sure baby is growing. Assess size to know exactly what the date of the pregnancy is, because this has very important implications later on. For example, you can have a 34-weeker by dates who has a baby that measures 31 weeks in size. Is it actually a 31-week baby that's growing normally with wrong dates, or else is it really a 34-weeker with a small baby? We also have to assess chorionicity, which means how many babies there are and basically whether they share or not the placenta. Because with multiple pregnancies there are increased risks like preterm delivery, blood pressure problems, increased risk of abnormalities. But then babies that share a placenta, the monochorionic twins, also carry a risk of having abnormal vasculature in the placenta, and blood from one baby goes to the other, something which we call twin-to-twin transfusion, which is potentially treatable if dealt with early. If we get it late, then sometimes we lose both babies. Apart from that, we also do an anatomical checkup, just make sure that all organs are where they should be and the development is as it should be. Occasionally, parents decide that they want also screening for chromosomal abnormalities, and that is when the test becomes a nuchal scan instead of a simpler dating scan. The nuchal scan is a test where basically we look for markers which give us an indication of the possibility of the baby having a chromosomal abnormality. Even though it's called a nuchal scan, we check more things than just the nuchal thickness. We look at the nasal bone, the blood flow in one of the heart valves called the tricuspid valve, blood flow in the ductus venosus, heart rate, and the nuchal thickness itself. Then there is a special software which will combine those 5 with maternal age and ethnicity, and that will give us a probability. What is the risk of baby having a chromosomal abnormality? Serum markers, especially PAPA and HCG, can be added to improve the accuracy of the test. Nowadays, we are lucky as well that we have the option of doing fetal DNA testing. Basically, some fetal DNA will be in the maternal bloodstream, which is detected and amplified so that we can assess whether one of the 3 commonest trisomies, which are trisomy 21, 18 and 13, whether one of them is present. The main issue with just doing this blood test, because people might say, why don't you do the blood test straight away? It's more accurate than a scan for those 3. But ultimately, that test will screen only for those 3 syndromes and sex chromosome abnormalities. If you do that, basically we are losing out on 27% of the chromosomal abnormalities because basically 27% are atypical, so they're not those 3 plus sex chromosome. Once the first trimester ends, the most important scan according to me is the second trimester anomaly scan. Best time to do it is between 19 and 24 weeks. It is the time where most anomalies are seen. By now the baby has grown. For example, the heart is roughly the size of a grape, so we can see more information. Fetal anatomy is studied in depth from head to toe, and we need to confirm that all the organs are developing properly. The most difficult organ to assess is probably the heart, and it's one of the commonest organs to have an abnormality. In the second trimester scan, the anomaly scan is very important to assess the placenta. We need to know where the placenta is, whether it's too close to the cervix or not, placenta previa or not, and possibly start looking into adherence, morbidly adherent placenta, which can give problems after delivery. The third trimester is a bit of there is conflicting evidence on timing of a scan in the third trimester. I like to discuss it as between 28 and 34 weeks, depending on when the anomaly scan is done. If you have an early anomaly scan, you might do the third trimester scan closer to 28. If it's a late anomaly scan, you might do it later on. The aim of the third trimester scan, the importance of the third trimester scan, is evolutionary abnormalities. As we mentioned before, it's pregnancy is an evolutionary process. So we might have problems that are developing as time goes by that are not seen in the first or second trimester. So having another... Exactly. Commonly, one would mention renal abnormalities, diaphragmatic abnormalities, heart defects like left hypoplasia. So it's always important to have another look. Also, growth problems, they rarely occur before 24 weeks unless they are severe. So, after 24 weeks, if there is going to be any growth abnormality, the best way to identify it is with a growth scan, which is usually done in the third trimester. Some people opt to do a 4D scan as well. The 4D scan is a live 3D image of baby's face most of the times. Sometimes you can see the hands and other organs. But when I do it, I prefer doing it between 26 and 30 weeks. The reason is that to have a nice image, you need an adequate pool of fluid in front of the structure you want to assess. Apart from anatomical assessments, throughout these 3 scans, one can screen for risk of preterm labor and placental problems like preeclampsia and IUGR. Then obviously there might be extra scans in the pregnancy. For example, the earliest time we can see a pregnancy, signs of a pregnancy, is roughly 4 weeks, 4 days. Only if you have the perfect patient with a good machine. Unfortunately, the perfect patient is uncommonly met, because you need to have a thin patient, anteverted uterus, everything in its place, which most of the time is not possible. So routine, unnecessary early scans are not recommended. As I said earlier, dating can be wrong, so you might have someone who comes in at 5 weeks who is actually less than 4 weeks pregnant. Mm-hmm. If that is the case, we'll have a positive pregnancy test, no pregnancy seen, which will obviously cause a lot of concern. It's something which we call pregnancy of unknown location, which ultimately could be one of the 3 options of pregnancy. It's either a normal pregnancy that's too early to be seen, it is a pregnancy that started and stopped, so it's a miscarriage, or else it's an ectopic. So unless indicated, we try not to do scans very early on. Obviously, if someone is pregnant and she has pain or bleeding, we need to assess, so we might need to scan to exclude ectopics or miscarriages. Later on in the pregnancy, if there is a problem with the routine scan, for example growth issue or as a structural abnormality, extra scans will be included. And also if maternal condition changes. Let's say someone develops preeclampsia or diabetes, extra scans might be needed depending on the requirements. What I would like to mention also is the query about vaginal ultrasound. Vaginal ultrasound does not cause harm in pregnancy. Early on, let's say before 8 weeks, vaginal route is probably the best way to assess. Also, to assess for cervical length, and in the 3rd trimester, if you have a posterior placenta, which you suspect is a low-lying placenta, the best way to check the distance is via vaginal scan.
I also understand that there's time and age. In fact, we're transmitting this interview through the internet, so parents will be stressed because they hear a lot of things, they see a lot of things through the social media, through the internet. And how can the role of antenatal ultrasound screening alleviate their concerns?
One of the major concerns is that ultrasound causes disease. ISUOG, which is the International Society of Ultrasound in Obs and Gynae, have released a number of recommendations and studies that have shown that ultrasound is not a cause of disease. Obviously, one must not do unnecessary scans. The role of ultrasound is to improve babies' outcomes, whether it's delaying surgery, whether it's delivering abroad, whether it's having a particular person, let's say a neurosurgeon, whatever the reason, the role is to improve outcome by having correct antenatal detection. One must always keep in mind that, as with all medical tests, it's not 100%. So, for example, 95% of cases of spina bifida can be detected in the Anomaly Scan. 95% is a high percentage, but it's not 100. Also, parents, we need to inform them that the limitations of the scan, we cannot give false reassurance. For example, when we're checking the brain, we're checking the structures, we cannot check function. And also some problems are evolutionary, so they have to be informed, they have to know that this is a scan, until now we're seeing this amount of information, things can change later on. One of the things which the potential negatives of ultrasound is that we give false information, in the sense that we see something that's actually not there, it's a false positive. It's uncommon, but it does happen. These are the times when we enjoy making mistakes, in the sense that if we think there's a heart defect and it's not
And then
there,
later
it's
it's
all
not.
good.
And you'll be able to reassure them.
Exactly.
So giving information to the parents is crucial in this regard. And I also understand that many parents speak about 4D ultrasound scans, and there's a lot of hype sometimes about them. What can you tell us about the difference between 3D and 4D ultrasound scans?
The fourth dimension in a 4D scan is time. So 4D scan is a live 3D image. It rarely has the 4D bit per se is rarely of clinical significance. The major benefit of choosing to do a 4D scan, the way I see it, is that it gives time to the doctor to have a good look at the baby. It's sort of a second anomaly scan. Occasionally 4D is used for certain surface defects like spina bifida and cleft lip, but these can be detected and studied properly also in the 2D form. 3D is important in gynecology assessment, especially in investigations for infertility and recurrent miscarriages.
And on to my last question. Who can perform an ultrasound scan?
Anyone can have access to an ultrasound machine and use it on a gravid uterus. Most pregnancies have no issue, so statistically speaking, whatever is seen or not seen will have ultimately no effect. Unfortunately, we've had a number of poor outcomes, potentially treatable if detected earlier, but were not detected because the scans were performed by untrained individuals. It is very, very important that people who will do these scans are adequately trained. None of us would do an echo on an adult without adequate training, but unfortunately in obstetrics we have many healthcare professionals without training that are doing the obstetric scans. The aim is not to see a heartbeat, the aim is to check that the heart is working properly. And also, even in people that are trained, there are various levels of training. There is referral upwards, so you have basic scanners, and then there's a ladder that you always refer upwards. And we also have to keep in mind that antenatal screening is only the tip of the iceberg. Antenatal screening is only a small part that will lead us into a whole new sphere, which is fetal medicine. Fetal medicine is a small super specialization of obstetrics, which deals with the patient, with the fetus as being the patient. So unless we're doing these scans and they are properly trained, this scenario is completely lost.
And that is very important. And on that note, I thank you, Mr. Cordina, for being with us here today. I hope that this interview has helped to further your knowledge on the role of antenatal ultrasound screening. And I invite you, our audience, to follow our Facebook page, TheSynapse, and to subscribe to our YouTube channel. Thank you so much.